Lecture 18, we're going to be reviewing the front office personnel. The front office personnel really do play a critical role in maintaining an efficient and smooth schedule for the dental office. They must possess excellent organizational habits, good communication skills. They need to have the ability and an in-depth knowledge of how to prepare insurance claims, maintain a competent and well-organized, in addition to a cost-effective and efficient schedule. Answering the telephone plays a huge part in the front office team. Any patient that calls the dental office needs to feel that their questions are answered, their needs and concerns have been handled in a professional and competent manner. For a potential new patient, oftentimes the way that this phone call is answered can determine if the patient wants to choose this as their dental home or continue to seek other options. So that is extremely important. Telephone etiquette, as mentioned, is extremely important, and communication skills. One of the most important qualities that the front office team needs to possess is a pleasing personality and the ability to capture all pertinent information in an effective manner. No patient wants to be on the phone for an extended length of time. Maintaining a dental office schedule is extremely important. Scheduling dental patients can be very complex. It requires a great deal of knowledge and finesse. The biggest challenge in scheduling is that the doctor's schedule should be set up so that the appropriate amount of time is allotted for each patient without any downtime in the schedule. If the schedule is too tightly booked, patients are going to end up waiting too long for the doctors. This leads to agitated patients and stress for the dentist, back office assistants, and the front office team. The ideal schedule gives the dentist the correct amount of time for each procedure. It creates an efficient workflow while minimizing patient wait time and maximizing the number of procedures and patients being seen. Without a basic knowledge or understanding of dentistry and dental procedures, the schedule cannot be coordinated effectively. Patients checking in and patients checking out. Check in when a patient arrives at the dental office. The front office team is the first welcome and the first person to greet that patient. So we want to make sure that we are giving that patient a very warm and welcoming greeting. If it's the patient's first time to the dental office, again, a warm and welcoming greeting and obtaining the correct information from that patient. We want to make sure that we get the correct dental insurance information, secure a copy of the card, sometimes even a photo ID of that patient, as well as any forms that are standard for your office. You'll want to make sure that you give the patient every form that they need to complete and give them instructions on completing those forms. Once those have been done, you'll want to secure that information, put it into the patient's chart, and make sure the back office team has that information so that they can begin the next step of that appointment. Check out. When treatment has been completed, the patient is then directed back to the front desk for checkout. At this time, payment is going to be collected and any new appointments are going to be made. And this should have been discussed prior to any treatment. Dental insurance verification plays a very critical role in the dental office. Anytime a patient has dental insurance, you'll want to collect the appropriate information and then contact the dental insurance company and get their insurance verified with any history, any specific frequency limitations, and co-insurance amounts. That information is then entered into the dental software so that going forward, any appointments or any treatment that's discussed, you can give that patient accurate insurance information and any out-of-pocket expenses for them. Treatment plan presentation and explanation. When a patient comes into the dental office, the dentist is going to diagnose any treatment. The treatment plan is then entered into the patient's chart, and from that point on, The front office personnel or treatment coordinator oftentimes is going to be reviewing that information with the patient. That it includes any insurance information, and they should feel confident in going over that dental treatment with the patient. Treatment plans can range anywhere from a routine dental cleaning to more complex restorative dental work. As I said, the treatment plan is going to be dictated by the dentist to the back office assistant, who then puts it into the software, then ultimately to the treatment coordinator or front office personnel. I really just kind of went over that, I feel like.
Okay.
So,
Do you want to just?
okay. That concludes lecture 18. No. That concludes our lecture 18, which is more geared towards the front office staff.